Bismillah ar-Rahman ar-Rahim. Aminoglycoside, the chemistry of aminoglycoside. The aminoglycoside are protein biosynthesis inhibitors, bactericidal antibiotic with a broad antimicrobial spectrum. Aminoglycoside antibiotic contain the pharmacophoric 1,3-diaminoinositol moiety, which consisting either of streptamine, which called the streptidine, which has two highly basic guanido group, which it is at C1 and C3, like streptomycin. The deoxystreptamine, like gentamicin, kanamycin, and tobramycin. The spectinamine, like spectinomycin. As we see here, the inositol, and here the 1,3-diaminoinositol. The functional group here, as we see, 6 hydroxyl group, and in the 1,3-diaminoinositol, 6 hydroxy group with with two amino group at carbon 1 and 3. Here it is the streptamine and streptidine. Here the 2-deoxy streptamine, which the loss of uh, the the OH at carbon number 2, and here the spectinamine. Okay. The several of the alcoholic function of the 1,3-diaminoinositol are substituted through the glycosidic bond with characteristic amino sugar to form pseudo-oligosaccharide. Okay. Aminoglycoside antibiotic are polar in nature with freely water soluble at all pH, so they are freely soluble and can be injected as IM, more commonly by IV infusion, and they are basic and form acid salt. They are inorganic acid salt, almost sulfate, and very soluble in water. They are poorly absorbed following an oral administration, and we given orally example kanamycin, neomycin, and paramomycin. Paramomycin. Their action is confined to the GIT infection. They are used topically as solution or ointment for ophthalmic. Tobramycin is available for inhalation to treat the Pseudomonas aeruginosa infection in cystic fibrosis patient. This route of administration result in significant reduced their toxicity. They are unable to cross the blood-brain barrier, so it is not effective in the infection of the brain or any bacteria or microbes that cross the blood-brain barrier, uh, and so they cannot be used for treatment for meningitis unless they are injected directly into the central nervous system. They are excreted in active form of high concentration in urine following injection. When the kidney are not functioning efficiently, the dose must be reduced to prevent the accumulation of toxic to the toxic level. The toxicity of aminoglycoside are two, mainly are two: the ototoxicity and nephrotoxicity. The ototoxicity to function mediated by the eighth cranial nerve, such as hearing loss and vertigo. While the nephrotoxicity there can be used to lead the kidney to tubular necrosis, producing the decrease in the glomerular filtration. These toxicities limit their elimination clinical use to infection by gram-negative bacteria. As we see here, the mechanism of action, the aminoglycoside, and here the aminoglycoside block the initiation of a protein synthesis and block further translation and elicit premature termination and incorporation of incorrect amino acid. Inhibit the aminoglycoside inhibit the protein synthesis by the cross the cell membrane by energy dependent uptake process, and they bind especially to the 13S ribosomal subunit and prevent the movement of the ribosome along the mRNA, so that they are triplet code on mRNA and can no longer be read. Because these ribosomes in human cell are different in structure from those in bacterial cell, they have much lower binding affinity in aminoglycoside, which explain the selectivity of this drug. So, the activity of aminoglycoside is increased if they administered with agent which disrupt the cell wall synthesis, as this increase the uptake into the cell. However, the bacteriostatic agent should not taken with aminoglycoside because these inhibit the energy dependent uptake process, and aminoglycoside which the aminoglycoside that cross to the cell membrane. The bacterial resistance to the aminoglycoside ability of the bacteria to synthesize R factor mediated enzyme which inactivate the molecule through the N-acetylation aminoglycoside acetylase, and by other phosphorylation the aminoglycoside uh, phosphorylase, and O adenylation the addition of adenine group to the aminoglycoside nucleotide transferase specific functional group which is preventing the subsequent ribosomal binding. The novel functional group can be attached to remove the functionally which convert these antibiotics to poor substrate for the R factor mediated enzyme, and this expand their spectra. The second one is the mutation of the ribosomal A site, and third, decrease the aminoglycoside aminocyclitol uptake into the bacterial cell. As we see here, the streptomycin inactivation by phosphorylation, adenylation at this hydroxyl group. And we see the composition of the streptomycin, which here it is the streptidine, and here the alpha streptose and alpha L methylglucosamine. Unusual pharmacophoric unit streptamine, which account in for its unusual antibacterial spectrum. For the systemic action, streptomycin is given by intramuscular. It was the first effective agent used against tuberculosis because streptomycin is not orally absorbed and destroyed, not destroyed significantly in the GIT. It's be used in treatment of intestinal tract infection. Resistance by the N-acylation and O-phosphorylation and O-adenylation specific functional group. Gentamicin, as we see here, the structure of gentamicin, the acylation is at site 2 carbon. It's chemically stable against heat and acid and alkali. Gentamicin, the missing of the uh, hydroxyl at carbon 2, which have served as targeting for R factor mediated enzyme, which enhance its antibacterial spectrum. And it's inactivated by N-acylation and O-adenylation. It has significant activity against Pseudomonas aeruginosa infections. So they, for urinary tract infection, burns, and some pneumonia, and bone and joints infection can cause by susceptible gram-negative bacteria, and used topically in drops for treatment in eye or ear infection. It's combined with the other anti-effective agents, but interesting incompatibility has been uncovered. With certain beta-lactam antibiotic, the two drugs react with each other so that the N-acylation on carbon 1 of gentamicin by the beta-lactam antibiotic takes place. Thus, inactivation of both antibiotics occur. So, if I ask you in any exam or question why we cannot give antibiotics or both gentamicin or other beta lactam antibiotic in the same time, you should answer this by that the two drugs will react with each other and an acylation occur on the carbon number 1 of the gentamicin. Therefore, the two agents should not be mixed in the same solution and should be administered into different compartments. Here, the kanamycin, as we see, it is chemical stable against heat, acid, and alkali as gentamicin. However, is unstable against R factor enzyme, giving inactive transformation product. and acylation and or phosphorylation. The injection of kanamycin are painful enough to require use with a local anesthetic. Here it is the amikacin and tobramycin. Kanamycin, as we see, kanamycin A. Amikacin is made semi-synthetically from the kanamycin. The 1-hydroxyaminobutyrylamide, a moiety attached to the N3, inhibit the adenylation and phosphorylation in the distant amino sugar ring at carbon 3 and carbon 2, even that the hydroxyaminobutyrylamide substituent is not where the enzymatic reaction takes place. So this will lead to decrease the binding to the R factor mediated enzyme. Strongly enhanced potency and spectrum. Amikacin used in treatment of sensitive strain of M. tuberculosis and P. aeruginosa infection, which are resistant to the other agent.